Okay, so you're a nursing student, right? And you know one of the biggest first steps you're going to take is picking a great research problem. It sounds kind of daunting, but don't worry. We're going to break down exactly how you can find one that really, truly matters.
Let's kick things off with this really powerful analogy. Think about it. Your research problem? That's your destination. You wouldn't just start a road trip without knowing where you're going, right? Because you just end up anywhere. Choosing that destination carefully from the get-go is what makes the entire journey focused, purposeful, and, in the end, super impactful.
All right, so first things first, what exactly is a research problem anyway? Let's get a clear definition on the table. At its heart, a research problem is really just a gap. It's that space between what we know and do in nursing right now and what we should be doing to give the best possible care. Your research, that's you building a bridge to cross that gap. It's how we improve patient outcomes and push our whole profession forward. And listen, getting this part right at the start it's absolutely crucial. I can't stress this enough. Your problem statement is literally the foundation for everything else you're going to do. It decides what you'll study, how you'll study it, and ultimately, what you can even hope to achieve.
So you might be thinking, okay, great, but where do these amazing ideas come from? Do I have to wait for a lightning bolt of inspiration? And the good news is, no, not at all. The best ideas are actually all around you, every single day, in your clinical practice.
So, let's dig into some of the most common places that you, as a nursing student and a future nurse, can start looking for those fantastic ideas. Just look at this. The sources for research ideas are, well, they're everywhere. An idea can pop into your head right there on the ward, a question you've always had about a certain procedure, or it could come from a more academic place, right? Maybe you're reading a study and you think, hey, they should have looked at this. Or it could even just come from talking with your friends, your classmates, your mentors. All right, so let's say you've got an idea. You're excited about it, but how do you know if it's actually a good one? You need more than just a gut feeling, right? You need a solid, reliable toolkit to really evaluate its potential. So let's walk through the 5 key criteria for a rock-solid research problem. First up, number 1, significance. You got to ask yourself, does this actually matter? Will my findings make a difference to other nurses, to patients, or to the healthcare system as a whole? A significant problem is one where the answer is yes, it really contributes something meaningful. Next, and this is a big one, you have to be super realistic. Is your idea feasible? I mean, a world-changing idea is awesome, but it's totally useless if you don't have the time, the money, or the access to people and data to actually study it. It's always better to do a smaller, really well-done study than to start a huge, ambitious one and not be able to finish. Okay, number 3 is novelty. Your research needs to be original in some way. But hold on, that doesn't mean you have to discover a cure for a disease. Novel can be as simple as looking at an old problem with fresh eyes or trying a known solution on a new group of people. The goal is just to add something new to the ongoing conversation in nursing.
Now this one is completely 100% non-negotiable. Is it ethical? Your research must protect the rights, the privacy, and the well-being of every single person involved. If an idea can't be explored ethically, then it can't be explored. End of story. Full stop.
And finally, number 5. Is your problem actually researchable? This just means, can you measure it? Can you collect data on it? Vague ideas or big philosophical questions are interesting, but if you can't observe them or quantify them somehow, you can't do a scientific study on them. You need something you can actually investigate. So there you have it. That's our toolkit. Now let's put it to work and see how it can help us visually compare a few different ideas and pick the winner. Just imagine for a second that you're trying to decide between 3 different topics. You're passionate about all of them. Well, by stacking them up against our criteria, we can take all the guesswork out of it and make the best choice really clear. Okay, check out this spider chart. It does a fantastic job of showing the strengths and weaknesses of each option, right? Now, look at research problem 1. That's the blue line. See how that scores really high on almost everything? It's significant, it's feasible, it's novel, and it's ethical. The other 2, well, they have some good points, but they fall short in some really key areas. This chart just makes it so obvious that problem 1 is the strongest, most well-rounded choice. Okay, let's pull all of this together and think about your next steps as you get ready to start this really exciting part of your nursing journey. So here's the bottom line. The most important thing to remember is this.
If you're systematic, if you're thoughtful, you can pick a research problem that not only checks the boxes for your assignment, but also sets you up for a project you can be really proud of. Using these criteria just transforms what seems like a huge, scary task into something totally manageable and strategic.
And now, it's your turn. Seriously, this isn't just another school assignment. This is your chance to add your voice, your piece of the puzzle, to the evidence-based practice that is the future of our profession. It's your chance to ask a question that could genuinely improve care for so many people down the road. So, what question are you going to ask?